Good afternoon, everyone. My name is Amy Smallers, and I'm Senior Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, AI Governance in Healthcare. Where are we and where do we go from here? A few logistics before we start. If you have questions during the webinar, please place them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to get them addressed during our time together today. I also want to take a moment to thank MHA's 2024 annual sponsors, as well as our strategic partners, for their support in underwriting today's webinar, which is just one of many events we offer throughout the year to connect our members with leading experts to help address timely issues like the one we have today. I'm pleased to introduce our speakers from Robinson & Cole, Kate Healy and Lynn Friedman. Kate is a member of the firm's healthcare group and data privacy and cybersecurity and artificial intelligence teams. She advises diverse healthcare entities on transactional and complex healthcare regulatory matters. She has extensive experience counseling clients with respect to strategic affiliations, mergers and acquisitions, joint ventures, including cross-sector ventures, and other transactional matters. She also counsels clients with healthcare contracting involving healthcare regulatory, artificial intelligence, virtual health, and health information technology issues. Lynn is chair of Robinson & Cole's data privacy and cybersecurity practice and the AI team, and is ranked nationally by Chambers in privacy since 2012 and globally since 2021. She focuses her practice on compliance with state and federal data privacy and security laws and regulations, emergency data breach response, mitigation, and litigation. She counsels clients on state and federal investigations and enforcement actions. She's also former deputy chief of the Civil Division of the Rhode Island Department of Attorney General and has been practicing in data privacy and cybersecurity since 2003. Thank you both so much for being here, and I will hand it over to Kate and Lynn to get us started.
Great. Thank you, Amy. It's a pleasure to be with all of you this afternoon. Lynn and I are going to go through the slides. We have a lot of material to cover, so we'll try to save some time at the end for questions. But please know we're always happy to take questions, and you're welcome to follow up with us afterwards if we can't fit everything in 45 minutes, which goes by awfully fast. So next slide, please. So just a note about our presentation, we are not going to be giving legal advice during this presentation, but you are welcome to follow up with us if you do have specific questions. Next slide, please. We also wanted to talk just for a brief minute about what we'd like to cover today. First, we'll go through a little bit of background on the rise of AI, especially in healthcare. Then we'll talk about the uses of AI tools in healthcare. Next, we'll go over some important risks and benefits of AI tools. We'll also cover the current legal and regulatory landscape. Then we'll turn to some practical considerations and some key takeaways from the presentation. And finally, we do have a slide at the end that provides a number of resources that you might want to take a look at after the presentation today. Next slide, please. As you probably know, AI use in healthcare has been going on for a while, and it has really the potential to change many facets in the delivery of healthcare. We'll talk more about this throughout the presentation, but many of us are aware of the use of AI in a number of the areas on this slide. AI is already being used through robotic surgery, and virtual chatbots can interact with patients to collect routine and reference information. For many providers, AI is already being used to reduce administrative burden and burnout by assisting with routine documentation. There are several AI-powered applications that can record a patient visit and at the conclusion of the visit, generate a first draft of the clinical note for the provider's review. We'll talk more about that interplay between the tool and the provider throughout the presentation today. Next slide, please. It's worth noting that the use of AI in healthcare isn't new. The rise of AI began in the 1950s, and the term AI was coined in 1956 to describe the science and engineering of building intelligent machines. The first robot capable of interpreting instructions was unveiled by Stanford in 1966. Fast forward to 1989, when Cedars-Sinai cardiologists introduced CoreSage. Some of you may be familiar with CoreSage, a clinical tool that combines AI and statistical techniques to help physicians identify patients who are most likely to experience another cardiac event. The Human Genome Project also resulted in a wealth of data on the genetic basis of disease. That project also led to further studies of mapping of the human genome and the use of algorithmic calculations to discover more about disease. Next slide, please. The advancements have steadily continued. In 2017, the FDA approved a product that analyzes heart MRIs in seconds and deep learning applications that began to be used to screen for diseases such as skin cancer with incredible accuracy. The FDA also approved the first AI-powered device for use in the operating room. And in what may be the biggest development on this slide, ChatGPT was launched in late 2022 and became mainstream in 2023, ushering in generative AI. We'll talk more about the difference between regular AI tools and generative AI later in the presentation. Next slide, please.
So we can talk about that now, actually. Hi, everybody. So it's really important for you to understand the difference between AI tools and generative AI. And we have been using AI tools in the healthcare space for decades, as Kate just went through. Where we're seeing an explosion of use now is with the adoption of ChatGPT, and that's generative AI. And what that means is all of the data is, they're scraping all sorts of publicly available data, and then people are putting in queries, and the queries are coming out with responses. And it's super fun to play with, but there are a lot of risks associated with that, which we're going to talk about. So the types of AI tools, not necessarily generative AI tools that have been used in healthcare are, neural networks and deep learning, natural language processing to make it easier for notes and things like that, interactive diagnostic tools, physical robots, and robotic process automation. Next slide, please. When you talk about generative AI, this is just a very short list of all the Gen AI tools that are out there that some of your employees are probably already using because it's super fun, as I said before. The generative AI tools are rapidly expanding because, we live in an entrepreneurial world, and we've got lots of entrepreneurs out there that are developing new tools. So when you are talking about AI governance, which we're going to talk about in a minute, you need to make sure that your AI governance program is distinguishing between AI tools where it's only using your data, only for your purposes, only for your efficiencies, and the use of Gen AI tools, because that's where the Gen AI is really where a lot of the risk is involved. Next slide, please. So what are the risks of the use of AI in general? We will talk about it, but the president came out with an executive order that you should read from October of 2023, and it really is a great resource to research all of the risks associated with AI. And one of the biggest risks from a public policy standpoint, but also from a healthcare standpoint, is bias and discrimination. Because when you're thinking about, there's been, bias and discrimination in the healthcare world, as in every other world. And when you're talking about using data from decades ago that's publicly available and you're putting it into a large language model for it to learn, it's learning bias and discrimination because it doesn't have an independent thinking process. So bias and discrimination in the healthcare space is a big risk when you're talking about the use of AI tools that are using data from decades ago. Inaccurate output, you've all heard about hallucinations. That's definitely a risk associated with the use of AI, because if the source data is inaccurate, and there's lots of reasons for that, because they are taking everything in, whether it's been independently verified or not, it could spit out a hallucination, and that would be very detrimental in the healthcare space, as you know. The infringement of IP is also a big risk with the use of AI, because again, it's using data that's out there that that may be somebody's intellectual property, but that it's publicly available. They're not taking the intellectual property into consideration. So we've seen litigation around infringement of IP around large language models using people's intellectual property. Professional liability, Kate's going to talk about that in a little bit, but that is a big risk in the healthcare space, because obviously if you're relying on a large language model to give you a diagnosis and it's based on information that could be inaccurate, and you rely on it and you use it as a diagnosis, you could be subject to liability. And then obviously unauthorized disclosure of both protected health information and personal information when you are inputting individually identifiable information into a large language model. There's no way to get it back. Next slide, please. So we talked about this, but one of the things that is very important when you are assessing AI tools is to look at how it's developed, what the requirements are. This is something that's in the executive order that is, I think we're going to hear a lot more about. As if we get regulations in place, the developers are going to have to put in processes to show that they were looking at the data and making sure that the algorithms do not perpetuate bias and discrimination, but that's one of the risks. Next slide, please. The data sources may be inaccurate. We talked about that. Next slide, please. And then there's AI risk to privacy. And that is, in the healthcare space, one that I'm very concerned about, because as I said before, your employees are probably already using ChatGPT. They don't understand how it works. They don't understand that if they put data in that is identifiable, there's no way to get it back, and it could be used for a query and a response later. That's an unauthorized disclosure of protected health information and personal information. And it's using that data to train, and it could be in an output for somebody else. So one of the things that's really important in your AI governance program is training your employees and educating them, because, just like we have to educate everybody about phishing and smishing and vishing and crishing and all the things that we educate them about for the unauthorized disclosure of PHI. This is one that they don't understand, and you need to educate them as part of your program, because the AI risk to privacy is real. It's there. We've already seen incidents of it. Next slide, please. And then AI has risk to security. We're seeing threat actors. We've seen threat actors use AI in the past to infiltrate and then gather data, then exfiltrate it. They use AI to find all the best data, the PHI, the PII. We're going to see threat actors, and we're starting to see threat actors use AI to get past the security measures that healthcare providers are getting hammered with threat actors, as you know. And so one of the things that is also of concern is the risk to the security of your data through the use of AI tools by the bad guys, because they can get them just like we can. Next slide, please.
Great. So Lynn just covered the privacy risks associated with the use of AI. And I think the next thing that we wanted to talk a little bit about is just the risk Lynn referred to with respect to professional liability. So I think the concern is that healthcare professionals may rely on the results of an AI tool and use the AI tool as a substitute for the healthcare professional's judgment in rendering a medical decision. And that can result, of course, in a deviation from the standard of care and a claim that the AI tool is engaged in the unlicensed practice of medicine. Similarly, over-reliance on the results of the AI tool can lead to care that deviates from the standard of care and result in a medical malpractice claim. By way of a real-world example, we're all probably pretty familiar that there are radiology tools using AI that can assist radiologists to interpret images and analyze large volumes of data. The risk, however, is that those AI tools may be used to replace a medical professional's clinical judgment or cause them to over-rely on the conclusions delivered by the AI tool. And that in turn can result in claims for the unlicensed practice of medicine or medical malpractice. The next risk that we did just want to briefly mention is a risk under the anti-kickback statute. The Office of National Coordinator has indicated that anti-kickback violations can occur. So, of course, the anti-kickback statute would prohibit an entity that offers or provides remuneration to healthcare IT developers, their customers, or others to arrange for the furnishing of an item or service reimbursable by a federal healthcare program, or recommending the purchase of an item or service payable under a federal healthcare program. And that behavior can implicate and potentially violate the anti-kickback statute. So, for example, remuneration by third parties to developers of certified health IT for integrating and enabling decision support interventions where one purpose of that arrangement is to increase sales of the third party's products and services may potentially violate the anti-kickback statute. Next slide, please. In addition to some of these legal concerns, the use of AI can also exacerbate existing ethical concerns. And as we know, there are a variety of sources of ethical guidelines and requirements. Ethical concerns can include threats to privacy, security, and informed consent. So, for example, physicians may need to be particularly mindful of informing patients of the risks and benefits of the use of AI technology in order to obtain informed consent for its use. In addition, the use of a particular AI technology may not provide the same outcomes across individuals of different races, genders, and socioeconomic status, and over-reliance on those results may raise ethical concerns also. Next slide, please. So what do patients and doctors have to say about AI? I think this slide is worth taking a quick look at because 2/3 of respondents, physicians, say there's an advantage to using tools with AI, but also the physicians most often believe that AI can and should be used to alleviate administrative burdens. So that's, I think, important to note. Next slide, please. As this slide highlights, it just may be that doctors are too optimistic about the benefits of AI. So only 1 in 5 uses ChatGPT in their professional life, whereas 1/3 of physicians admitted to using AI in their personal life. So a big disparity. I wonder if we took a poll today, I have a feeling that those numbers would look different. Next slide, please. I think it's also important to highlight that patients are still really uncomfortable with the use of AI in healthcare. So a majority of patients you'll see on the right are uncomfortable with both the use and reliance on AI in healthcare. Next slide, please. Conversely, some patients are using chatbots for medical advice. So this is just, I think, a warning slide. It's worth being mindful of the fact that patients are out there using chatbots for medical advice on their own because they view it as a convenient, free, and judgment-free feedback loop for them. And I think it's worth pointing out that legitimate medical AI chatbots may emerge to fit these needs. Next slide, please.
So as we discussed before, one of the issues with the use of generative AI tools is the fact that the information, and if let's just use ChatGPT as an example, the data that is input by the user goes into a black box. And, you know, when you look at OpenAI's deletion policies on their website, you know, they say right up front, don't put any identifiable data in here. Don't put any PII, PHI, don't put anything that's identifiable. Well, you know, no one reads those before they download ChatGPT. And if you've got users using ChatGPT or another Gen AI tool, they don't understand that OpenAI, the owner of ChatGPT, is saying, don't put it in because we can't delete it. There's no way to get it back. Once it's in there, it's gone. And that's one of the things I think is really important in your AI governance program, to really be thinking about how to, one, put guardrails around how people can use it. You don't want to prohibit it completely because people are using it. It's exciting. It's going to be really revolutionary for all of us. It's a matter of educating people to understand what the risks are and the fact that once that data goes in, you can't get it back. And OpenAI is very open and honest and transparent about it. It's up to the user to understand that. Next slide, please. So the importance of AI governance for hospitals is that the speed of AI adoption is, you know, I've been doing this a long time, and when ChatGPT came out, and it has been, it's been wild for me to see how fast consumers have really taken to it. The speed of the adoption of Gen AI tools and the risks associated with the use of Gen AI really highlights the need for a comprehensive governance process. So when you are thinking about developing your AI governance program, there are several things that we want you to be thinking about. One is you want relevant stakeholders to be included. So you want the entrepreneurs in your organization, the ones who are excited about AI, excited about how it's going to revolutionize our lives. And you want them to be part of it so that they will be your ambassadors for the guardrails around it. So you want to be able to let people use it in a safe manner, but also have champions out there that will say, look, it's super cool, but there's risks and you need to follow these guidelines or you're going to put our organization at risk. And so it's really important to get those stakeholders together, figure out what the guardrails are. You've got to educate. I'm going to say that a million times. You've got to educate people because they are very uneducated when it comes to Gen AI tools and what the risks are. And that they're evolving, they're getting better and better, but also we're seeing these entrepreneurs come out and they have a great product or tool, but they don't have the back end of, you know, proper insurance or being able to sandbox the PII or being able to delete the PII so that it's only aggregated and de-identified data. I mean, I'm seeing a lot of entrepreneurs out there and a lot of companies that are starting to contract with AI tools and Gen AI tools. And some of these companies are very young and are over their skis. So you've got to have a program around that to be able to assess the vendor, but also assess the risk of your users. And then one of the, I think a really important piece is, we do this for a living. We've got team members that are following these laws all over the country, from the feds to the state to the municipalities. And you'd be shocked, and I'm going to talk about this in a little bit, you're going to be shocked at how fast government is getting involved, and you've got to stay on top of it. What are the laws that are going to affect you and your organization in the state in which you do business, but in other states, because a lot of them have to do with where where the patient resides. So you've got to have someone on staff who's keeping track and being on the ball. It's hard enough with privacy laws and security laws, but now you've got AI laws on top of it. You need to have someone who's devoted to that on your team. Next slide, please. So the World Health Organization came out with a ethics and governance for artificial intelligence for health principles. And these principles are the basic principles around your AI governance program. And that should include, you want to protect autonomy, you want to promote human safety and well-being, you want to ensure transparency, foster accountability, and ensure equity, and promote tools that are responsive and sustainable. Next slide, please. So the Health AI Partnership is a resource, and we'll have other resources for you later. It's a great resource for you to take a look at. It's a multi-stakeholder collaborative that really is looking to empower healthcare organizations to use AI safely, effectively, and equitably. And it's coming out with great resources on AI governance and risk. It's a resource to help you make sure you're looking at the right considerations when you are determining the use of AI and emerging technologies in your organization. Well, the nice thing is it's community generated. There's lots of experts in there that know a whole lot more than all of us do about AI and the use of AI. And it's a peer learning collaborative space. And you might want to take a look at it as you're grappling, like everybody is grappling. Don't feel like you're behind. Everybody's grappling with this, but there are resources out there, and we'll give you some more in a bit. Oh, next slide. And then, you've got to align your AI governance program with industry standards. So you need to have someone on staff or someone on your team, on your AI governance committee, however, steering committee, I'm seeing different organizations call it different things. Someone needs to be on top of the compliance as well, because we're seeing regulations explode in this area, which I'll talk about in a bit. Next slide, please. So NIST is always out there when it comes to privacy security, no different than AI. They've got some great resources for you. There's an AI risk management framework. You really should take a look at it when you are trying to determine how you're going to incorporate AI tools into your organization, how it's going to be used. It talks about AI developers. It talks about users across the sectors, what everyone is doing in that space. What I will say is the developers of AI tools are not necessarily considering all the risks that you're considering in your organization. So when you are evaluating AI tools, it's really important to dig deep. Sometimes I'm on calls with clients that are doing due diligence on AI tools for their organization. And it's pretty surprising, I would say sometimes shocking, at how little the AI tool developers are aware of the risks associated with PHI and in particular HIPAA, PHI, unauthorized access, use, and disclosure. So really, take baby steps on this. If you're looking to bring in an AI tool, make sure that there are considerations that will manage the risk of using that tool, because there's a lot of entrepreneurs out there that aren't aware and aren't considering your risks when they're developing these tools. Next slide, please. So the White House came out with a blueprint for an AI Bill of Rights a couple of years ago. It was kind of the beginning of the White House getting involved and saying, look, we understand that there are risks associated with this, and we want to protect individual rights and liberties. And so the focus of the impact of AI tools on bias, discrimination, privacy, and access to critical services, it has been surpassed by the executive order that came out last October, but this should be part of your arsenal of resources when you're developing your AI tool. Next slide, please. Executive Order 13960 also was another iteration of the White House saying, look, we are looking at AI. We're going to come out with something that will address some of these issues. Next slide, please. And the most recent executive order was October 30th, 2023. You got to get this. You got to take a look at it. It's not that long. It's chock full of information. It is, from my perspective, a roadmap on how regulatory agencies are looking at AI. Look for developers, for users. We're going to see a bunch of regulations come out eventually about this. It's a blueprint. It's a mapping, a path forward of how regulation will handle this. And I think your AI governance committee, whatever you call it, needs to look deep into this executive order to understand what the feds are thinking about when it comes to AI. Next slide, please. Kate?
Next slide, please. So just in terms of what that regulatory landscape is beginning to look like, the FDA is going to play a really important role. It already does. The FDA, as you all may know, regulates medical devices. There are some existing exclusions for AI tools. There are proposed regulations, however, that really are targeting AI tools. The FDA has set out to regulate clinical decision support software, and the request for comments period on AI in drug manufacturing has concluded. So stay tuned for a final rule coming out on that subject. Next slide, please. So where are we in terms of the regulation of AI in medical devices? As Lynn mentioned, the number of AI-enabled systems has really continued to explode. The numbers almost doubled in the last 6 months. The classification schedule, and we have summarized it here, is largely based on the intended use of the AI-enabled software and the level of risk to patients if it's inaccurate. If the software is intended to treat, diagnose, or prevent or cure a disease or condition, then the FDA regulates it as a medical device. Many products that are determined not to be a medical device and use AI are categorized as software as a medical device. So what is included in the, I'm sorry, next slide, please. What's included in the proposed FDA regulation of AI? The proposed regulations would streamline medical AI approval by limiting the number of resubmissions that are necessary throughout development. Existing FDA rules require any changes to medical devices to be submitted for approval. And the proposed regulations would relax this requirement for software according to the developer's predetermined change control plan for modest changes that don't impact the system's intended use or functionality. Next slide, please. We wanted to take a minute to talk about clinical decision support software. And this guidance describes clinical decision support software functions that do not meet the device definition. So they're called non-device CDS. And they're based on certain criteria in the Food, Drug, and Cosmetic Act that excludes certain software functions from the device definition. The guidance really reflects the current thinking of the Food and Drug Administration on the topic. It does not establish any rights for any person and is not binding on the FDA or the public. You can use an alternative approach if it satisfies certain requirements in applicable statutes and regulations. And you do have to contact the FDA if you want to avail yourself of the alternative approach. Next slide, please. We also wanted to include just a slide about the FDA's request for comment, which we think signal a pharmaceutical focus. So in May of 2023, the FDA released the discussion paper using AI and machine learning in the development of drug and biological products to really ignite the conversation on AI and machine learning in the pharmaceutical research and development space. And this follows a similar discussion paper on AI in pharmaceutical manufacturing processes. Next slide, please. The Office of National Coordinator for Health Information and Technology has also come out with a final rule implementing the 20th Century CARES Act, which advances patient access, interoperability, and standards through algorithm transparency and enhanced information blocking requirements. The final rule impacts developers that participate in the ONC's Health IT certification program and those that create predictive models that are enabled by the interface with certain Health IT modules. It's worth noting that although the final rule applies to AI developers, there's a lot more in there. It also impacts covered entities by imposing an ongoing duty on covered entities not to discriminate against patients in health programs or activities that use patient care decision support tools. The effective date or the compliance date for those new rules come out in or begin in May of 2025. And for each patient care decision support tool, the covered entity is required to make reasonable efforts to mitigate the risk of discrimination. So this is really an important rule. Again, another one to put on your agenda for 2025 because it will affect hospitals. Next slide, please. The AMA has also begun to really wrestle with the use of AI. I was reading through some of the meeting minutes for the House of Delegates when it passed a resolution, and the resolution expressed concerns with generative AI as a medical resource because of the potential for errors and omissions and the absence of guardrails. Lynn talked about that earlier. The AMA is considering working with the FTC and others to protect patients from false and misleading medical advice produced by generative AI. Keep an eye on that. I think that's going to be a really interesting partnership, and I think it'll be really productive too. And the AMA is also focusing on and studying the benefits and consequences of generative AI, and it's encouraging its physicians to educate patients on the risks and benefits of using generative AI. So you're really seeing, I think, the AMA taking an active role in patient education. Next slide, please.
Yeah, and so Kate, to your point also, I think the OCR will probably get involved too if the FTC and the AMA are involved, because the OCR is the one that has jurisdiction. So we'll keep watching that as well. So I said before, this is a rapidly developing area when it comes to the regulatory landscape, and I'm going to give you just a little flavor of that so that I scare you a little bit to get someone on your staff to be watching this from a compliance standpoint, because we're seeing laws and regulations pop up that you might not think apply, but then when you dig in, you see that they could. So for instance, state AI healthcare legislation includes, in Georgia, there was a statute governing the control of hazardous conditions, preventable disease, and the sale and dispensing of contact lenses. And it defines eye examination to exclude information obtained solely from an automated testing device. And that's where I think it's going to get really complicated, because we watch, and we have the ability to watch national legislation on AI. And these are the kinds of things that are popping up because AI is included in these statutes. In North Dakota, they have a legislative study on AI and the state's institutions and youth, with a focus on healthcare and student well-being. Many states, as of this week, have adopted executive orders for establishing an artificial intelligence strategic task force, including Colorado, New Jersey, Pennsylvania, Massachusetts, DC, Oklahoma, Wisconsin, West Virginia, Washington, and Texas. And there's probably another one since we did the slide. And AI was cited to in many bills. So this is going to be, you think it's complicated to keep track of privacy and security and other CMS compliance guidelines. This is going to be a patchwork of regulations that you're going to have to keep an eye on. Next slide, please. And then in 2024, we've got a multitude. We're running out of time, so I can't go through all of them, but we're seeing Maryland and Artificial Intelligence Governance Act, Utah Artificial Intelligence Policy Act. Next slide, we'll get to Massachusetts. Here's state AI legislation that's pending, and you can see just in Massachusetts, look at all the bills that are pending. Some of those will get through. You should be watching those bills closely so that you can determine whether or not they apply to your hospital. Next slide, please. Proposed and pending legislation, again, same thing. There are dozens of legislative bills that are out there. You need someone that's following this closely and that can alert you when bills pass and when they are enacted. And it usually is going in the compliance department. That's usually where it goes, but someone in your organization has to be on top of this. Next slide, please.
Great. So we've been talking a lot about the background and the legal and regulatory landscape, risks and benefits. We're turning now to some practical considerations. We've included the next couple of slides, which distill, I think, the guiding principles for AI governance that we've taken from our review of the various EOs and other legal and regulatory authority that Lynn mentioned. So it includes making sure that the use of AI is fair and impartial, transparent and explicable, responsible and accountable. Next slide, please. Safe and secure, private, robust and reliable. Next slide, please. We also really suggest that you think globally about your AI governance strategy at an enterprise level. AI is here to stay. The Enterprise-Wide Governance Committee regarding the use of AI tools should encompass and cover employees, vendors, and subcontractors. We've included a number of suggestions of who to include and what to think about. It's really imperative that you begin to develop policies and procedures on the use of AI and insert contractual language into vendor contracts and map the use of AI and begin to monitor AI tools to ensure safety and compliance. Next slide, please. So again, a few key takeaways to leave you with. The use of AI tools in healthcare is here to stay. The speed of adoption has really far outpaced regulatory guardrails, necessitating caution with respect to AI use and monitoring. Healthcare organizations really need to develop and implement that enterprise-wide strategy, and compliance programs need to incorporate the use of AI tools so that healthcare organizations can become compliant as the laws and regulations emerge and we move out of this shifting sands sort of period that we're in and remain compliant on an ongoing basis. And we have a list of resources that we would highly recommend for your reading pleasure. Thank you very much for attending today. It's
So next
great to
slide,
work with
just
you.
so that there's some resources that we think are really important for you to have. So we put them in the slide. Sorry, they weren't on the slide. Thank you.
Thank you so
all.
much, Kate and Lynn. We really appreciate this. This is so much. I mean, any questions I had, you either answered and or I think I need to go back through. But we really appreciate this. This is such a great presentation, sharing your knowledge and with these resources. And for everyone to know, we will share this recording and the slides and make sure you have the resources. And we just really appreciate you all sharing your time and expertise with us today. And also for future events, we do have some upcoming events with our Wellbeing inaugural one with Mass Medical Society next month in November, our annual women's event, which is getting close to sold out. So if you're interested in that, please reach out to us. And of course, our flagship annual meeting event next January. So thank you again, everyone, for attending today. Kate and Lynn, for your presentation, and we look forward to seeing you at future events.